Can you tell
I
us
know.
exactly how you conducted the survey?
Yeah, so I guess the reason why we did this survey is like you're saying, there's been a lot of speculation about the potential mental health toll of COVID-19. There's been a lot of uncertainty. People who might not have been feeling anxious before or low might start to feel anxious and low during this time. And what we wanted to look at is how people are coping with this uncertainty and what impact it's had on their mental health. So what we did is we did an online survey, and it was during full lockdown in April. And we asked over 800 respondents. We had over 800 respondents from across the UK. And what we found was that nearly 40% of people reported levels of distress during April that were above clinical cutoff. And this means that, that it was really impacting them on their daily lives.
When you use those terms, so how do you define them? Someone who's critical when it comes to anxiety. What kind of answers were they giving you?
So somebody who might be feeling really anxious might be spending a lot of time worrying. They might be avoiding certain situations. It might be just kind of, I guess, if you were feeling really anxious, it might be all you think about. It might kind of distract you from doing things you want to do. A lot of people report physical sensations, so they might notice their stomach in knots. They might notice that they're shaking. I guess it changes from person to person, but that's the sort of things that we would see.
And I think the worst thing you can always say to someone who's suffering from this is, what are you worried about? But I'll ask you anyway, what were they worrying about?
Well, I guess, we weren't, that was kind of beyond the scope of this study. I suppose we were just looking at whether people were worried or not. Uh-huh. But I guess that, thinking about in general, there's a lot of things to be worried about at the moment. I guess particularly during, in April, people might have been worried when they would see their relatives again. Job security has been rocked. Yeah. People were worrying about their health. Government guidance is changing. So I think it would probably differ from person to person. But there's been a lot going on.
And so you were really on a mission to discover rather than to help.
Yeah, so I guess part of this is about trying to work out, what was going on for the UK population right now. I mean, in terms of, and that's really helpful, because if we can find out, what's people's experiences right now, we can think about how best to help people. So one of the other areas we looked at in this study is how people were able to cope with the uncertainty of the current situation, and what coping strategies did they use. And what we found is that people who struggle to tolerate the uncertainty of the current situation were more likely to use coping strategies that the research would say could be unhelpful, such as denial, denying the current situation, avoidance.
Drinking.
Drinking. Yeah, exactly. So things like that. And actually, that made those people more likely to suffer from mental health difficulties.
Everything, what goes up must come down, as they say. So, alcohol, drugs, I mean, none of them is going to work, is it?
Yeah, and I think that's really helpful for us to know, because if we know what makes people struggle more, we can start to think about how best to support people. So how can we build people's, tolerance of all of this uncertainty, and how can we help build people's resilience during this time? Because there is a lot of uncertainty and we're all adjusting, and the more we learn about how people are doing, the more we can think how best to help them.